Hi, everybody.
Hi, Bill.
Okay, there you go. Wake up. The topic tonight is the one that's near and dear to my heart as a practicing emergency room physician, is healthcare reform. And you might think, well, we already did that, been there, done that. That's so 3 years ago. But actually, it was just a start, and you'll see why as we talk about things here. But, our mission in PDA is, anyone? Healthcare,
Not warfare.
Healthcare, there you go. It's on your sticker. Healthcare, not warfare. Could be education, not warfare. Could be energy conversion, not warfare. Anything but warfare. All those resources need to go into conditions of human need, including healthcare. I'm going to let this incredible movie speak for itself. But first I'm going to tell you that that the numbers look like this, and you'll see some of them in the film. The numbers look like approximately 60,000 now people dying every year in America because they don't have money to see a doctor. They make a bad financial choice, and they refuse a CAT scan, or refuse being taken care of for some reason, or refuse their chemotherapy. It's incredibly expensive chemotherapy. So they may have coverage, but they don't have enough coverage. It's not just the uninsured in America, it's also a concept called underinsurance, where you don't have enough coverage. And when you go to the hospital and you come out with a bill, 5 or 6 figure bill, because you didn't know in the fine print that, whatever this and that weren't covered by your insurance money. So, in other advanced countries in the world, they figured that out. And they offer health care as a human right to their citizens. We have a right to use roads and highways, most of them at least. We have a right to police and fire. Anyone can dial 911. Why don't we have a right to health care? This is the 48th anniversary of Medicare. Yay, Medicare. Yay. That's worth applause. Medicare, which happened in the 60s after FDR tried to make it happen in the 30s. And you'll see it's talked about extensively in this film. But what if we had Medicare for all instead of just our seniors? Shouldn't we have it for everybody? We all pay taxes, we all get health care, all the health care that we need. We passed a health care bill 3 years ago. It was incredibly complex, like 2,000 pages. This is a bill that's been put before Congress, I think 6 times now, by Congressman John Conyers. It was co-authored by Dennis Kucinich. And it's 26 pages, and it says, H.R. 676, it says everyone will have Medicare. Everyone in the country will have Medicare. Yay. 26 pages. Not 2,000 pages. 26 pages. Everyone in the country will have Medicare. That's been brought up again in this session of Congress. We have, I believe, about 48 co-signers at this point. We used to have about 80. And then when the healthcare reform debate happened, about 30 of them dropped off. They dropped off. They said, we don't need that anymore. We've got the Affordable Care Act. That's not true. The Affordable Care Act will not cover everyone. I'm sorry, but it won't. Only about half of those people currently dying will be saved. And that's not enough. When 30,000 people, that's 10 times more than died in all of 9/11, are dying every year in this country. 125 people a day. 12.5 in California. Anyone know who the actor Kiefer Sutherland is?
Yes.
Most of us do. He's a famous guy who's the son of a famous guy, Donald Sutherland, who's the grandson of an even more famous person in Canada by the name of, anyone? Tommy Douglas. Tommy Douglas was a prairie preacher in Saskatchewan in the 30s who decided it wasn't right that people were dying because they couldn't afford to see a doctor. And he started the movement in Canada that got them health care for all. When we got it in the 60s, all we got it for was seniors. They got it for everyone in their country. So this is a film really about the difference between our two countries, the history, how that happened, and what remains to be done. How can we make it happen here? That's the hopeful part, really, is that we can make it happen here. We just need the political will to push elected officials or elect officials who are supporting it, and to make it happen.